Today we're going to talk about traumatic brain injury, better known as concussion, and we're going to talk about the fact that after you have a concussion, you should have your hormones checked. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner and chiropractor since 1979.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
And this is a really interesting subject to me. I've always been someone who has, I always hate when somebody starts with that. I've always been someone who, I've always embraced diagnosis. As you know, from the very first day that you walked in here, I've always felt that diagnosis was lacking in the fact that people really don't do maybe as good a histories as we used to, maybe because of time constraints. I don't know what the education is like now. We certainly don't do the examinations that we used to. We don't do full examinations. We don't do full neuro examinations, full general system examinations. And because of the types of new patients, populations that are developing these autoimmune problems, we're only now starting to understand concussion. We are really, truly are dealing in a world in which our doctors frequently don't really even have a full grasp of the conditions that they're evaluating because the data keeps coming out every day now.
Right.
So you're kind of working in a for those of you who want to know why you're not getting diagnosed well with a lot of different things, these are all factors as to why. This one is really interesting to me because people come into our office all the time and they have adrenal symptoms and they have sex hormone symptoms and they have growth hormone problems and they have thyroid problems. And so they've been to their endocrinologist and the endocrinologist, if they've been to an alternative doctor, the alternative doctor is going to say, well, we got to fix your adrenals because if we don't fix your adrenals, we can't fix anything else. If you go to the hormone doctor, they're going to start giving you estrogen or progesterone or testosterone or whatever it is it's going to be. If you go to the endocrinologist relative to your thyroid, forget it. It's like all over the place. And an awareness is growing in that area. All of these things have relevancy to our topic today because diagnostics are so important. You have to, in our world, we want to understand everything that is affecting the adrenals. And maybe you fix that and the adrenals get better. We want to know what's affecting the sex hormones. Maybe you're just stressed out of your mind, or maybe you have a concussion. Okay, but we want to know what's going on so that we can fix that without having to use hormone replacement therapy. Same thing with the thyroid, your growth hormone, maybe all of a sudden you're getting injuries, you're not getting better, a number of other things are going on if you're smaller, if you're younger, those types of things. And so this is a fascinating topic to me today because it goes directly to the heart of getting to the cause of these problems and having enough of a knowledge of your area of expertise to understand how to pull that string until you get to that point of knowing how to take a history and asking all the proper questions to find out why this person is having abnormal female symptoms or abnormal adrenal symptoms or so on and so forth. Mm-hmm. How's that for an opening?
That's a great lead-in.
Because I think that, because when I saw this subject, that's the first thing I thought. I do the intakes here, so I'm always trying to figure out, is this patient that we can help or is this patient that we can't help? And we have thyroids come in and we have stress and we have all these things come in. And so this is something that needs to be evaluated. We did a presentation on the gut and concussion. And this kind of a little bit goes hand in hand in that. You get a concussion, next thing you know, a couple of weeks later, you end up with a gut problem. Most people don't hook the two up.
Did we do a presentation on that? I was preparing for that.
Okay, we're going to do a presentation on that, and you'll see that has a similarity to this. So let's talk about the overview of, so we're going to talk about person gets a concussion and they start getting pituitary symptoms. And the pituitary is the master gland that basically controls all of your hormones. Okay, so concussion, have your hormones checked, but we're going to talk about concussion and the pituitary gland. So overview. Concussion, pituitary gland.
So I'll just give a quick overview because we've done other broadcasts on concussion, especially at the earlier part of this year. Gosh, we've done a lot actually. We've talked about a variety of things relative to the newest literature because, as Dr. Rutherford said, we're really trying to be up to date to the minute on this topic because we treat a lot of traumatic brain injury patients and concussion patients. What the new literature is showing relative to concussion and really post-concussion syndrome is that the blood-brain barrier, so the blood vessels that go into your brain, can become excessively permeable, which basically just means they're like Swiss cheese. So when you hit your head, your brain rattles around in your head, and so do the blood vessels. They kind of start to open up. And what can happen there is that your immune system from your body can then go into the brain and keep the immune system in your brain, which is fairly separate from the immune system in your body. It keeps the brain immune system turned on.
A blood-brain barrier is designed to keep everything from here down that's happening, and everything down here, whether it's inflammation, immunity, any of that stuff, it's designed to keep it from getting into your brain, where there is an entirely separate immune system and different type of nerve tissue in the brain than it is there. So that gets violated, all this crap starts going up there.
And the new literature is showing that that's a big reason why a lot of post-concussion syndrome patients just never improve, is because they get this chronic immune activation to their brain. It's called chronically activated microglia. So then your brain's immune system is turned on. Then also the energy producing parts of your cells, your brain cells called mitochondria, start to not work correctly. That's new literature. It came out a while ago, but now it's just really being verified in literature over and over again. So that's why a lot of post-concussion syndrome patients that go to think, they just have a hard time thinking. It's part of their brain fog. They're fatigued easily. They have a good day followed by 7 bad days because they overdid it on that one good day. So that probably may be sounding like yourself, or may sound like some of the symptoms you've observed maybe in a loved one who has post-concussion syndrome. And there's a lot of data there. As Dr. Rutherford said, we're going to do a whole presentation on really how the gut breaks down right after a brain injury and how significant that is to this whole process. But today we're going to focus really on the pituitary. And the pituitary, as Dr. Rutherford said, is our master gland. So we have hormones in our body such as testosterone, thyroid hormone, adrenal hormones like cortisol, human growth hormone. These hormones really serve a variety of functions that make us male or female, but also help us to heal from injuries. They really have a lot of effects on the brain and how the brain is functioning. We know, for example, when thyroid hormone is deficient, patients get depressed very easily. We also know that when adrenal hormones are deficient, people are fatigued extremely easily. And that goes for a lot of these hormones. But it really ties in from a number of perspectives. And relative to this topic, the pituitary gland is the master gland, and it kind of looks like a grape. Would that be how you kind of signify it for people who don't have a big background in neuroanatomy? And this little grape-like structure sits in a little cavity that encases the grape. And this pituitary gland, think of it as a grape, will secrete hormones that then go down to different areas of your body so that other hormones can be produced. And so we have the adrenal glands that make cortisol. We have the thyroid gland that makes thyroid hormone, got ahead of myself. Then we have the testicles that make testosterone. We have the ovaries that make estrogen in females. And then also the brain can make human growth hormone to circulate throughout our body and do these things. So that's kind of the overview.
Yeah, so most people understand that once we start talking about symptoms, most people kind of in the beginning maybe say, how could that be connected to me having a concussion? But then usually when we extend the discussion, most people can grasp that the brain controls everything. But we don't think of it in terms of the pituitary part of the brain or the hypothalamus and the pituitary, which work together controlling everything through your hormones. Because let me tell you, you are your hormones. and your hormones are what, they are what affect your frontal lobe. Your frontal lobe is where your personality is, your fatigue, your tiredness, your energy, your temperature, all that is controlled by your hormones, and that's all here. And who hasn't, and I might say if you're looking in here, you probably have had a concussion or know somebody who's had a concussion, but truly, again, going back to the assessment of somebody walking in the door, who hasn't had a concussion, if you really think about it? If you've had a car accident, even if you didn't hit your head and you were a little woozy afterwards, you had a concussion. Who hasn't hit their head on a beam somewhere and kind of been out a little bit, or things of that nature? And then maybe subtly, a little bit later, maybe a couple of weeks later, these symptoms start to show up in your bowels, or you start to get depression, and there's no way that you make that connection unless you're acutely aware of this type of data. And frankly, there's no way most of the doctors currently make that connection. They will, but at this point in time, this is kind of new data. So you wanted to go over the history of traumatic brain injury relative to the understanding that the pituitary can be affected.
Right, because
Like,
this
where
is
did
relatively new data
because
out there. This
that
has
led
been talked
to
about,
that,
yeah, for
to
a
the
few
newness.
years, but it's really been hammered in the literature lately. Like, there are a ton of research articles on it from this year. And really it was discovered 95 years ago, but then it just kind of went into the abyss. Nobody is really looking at it. We've talked about in other concussion broadcasts that frankly, a lot of post-concussion syndrome patients were kind of poo-pooed by their medical practitioners.
Absolutely.
So the medical practitioners thought that, you know, patients were still reporting these symptoms because they wanted to win a lawsuit, or because they wanted to go on disability, or they were trying to seek secondary gain from their employer. And so that was really the prevailing opinion. It wasn't until after kind of the concussion thing broke with the NFL that kind of the tide shifted in the literature, the scientific community, and the neurology community. So now everybody's kind of doing an about face, but we still see ridiculous stories from patients seeing certain practitioners who maybe are not abreast of the newest literature, and basically it's just saying it's all in their head. And
Well, there is confusing literature out there. The NFL, to some degree, is still National Football League for that one person out there who might not know what the National Football League is. They're still kind of sort of hedging and kind of, you know, so there's that confusion, and is it not? But eventually this data is going to prevail, because this is the data. We use this data in our daily practices. This is factual data, and it will prevail.
Yeah, this is big time stuff. And really, the more we look at it, we've talked about in other broadcasts, we're seeing changes in brain patterns in high school football players.
Yeah.
High school. These are kids who are half the size, lots of times, of these NFL football players. And these NFL football players are so much stronger and faster. In fact, Coach Harbaugh from the Baltimore Ravens this weekend came out and said he wishes they would just get rid of the preseason, because these guys are so big and so fast, their bodies can't sustain these forces for as many games as they used to in the past. It's just not possible. So anyways, that's the history on it, and we can kind of go into the next point.
Yeah, I'll add something to that too. And you can go back, and something that's really not noted. You can go back to childhood, and you get and maybe look at a child or look at yourself or something. And I've been able to do this from my own understanding of what's going on, and see where your child may have had an accident. Because the thing is, right now, what is the lay public's understanding of concussion is, if you have a concussion and somebody acknowledges, go home, wake the kid up, make sure that there's not a bleed, something like that, and then then go on with it. After you're done, go on with it. But you might go back and look and see if any of the things we're talking about now is happening, not just in football players, not just in people who've been clearly knocked out, but in somebody who just got their bell rung and are kind of like woozy, and maybe they start walking into rooms and forgetting why they're there and stuff like that. And a month later, it just clears up. But this damage may still be there, and it may change the types of functions that we're talking about here. So what happens, like you kind of went through this a little bit, you wanted to go over what happens when you get a concussion relative to what happens with the pituitary gland.
So relative to the pituitary specifically, when you hit your head and you have a violent brain injury, and the brain will kind of reverberate in the skull, that's how you want to think about it. This pituitary, which is like a grape, is sitting in this little cavity. So it may get stretched to a certain degree by that brain injury.
It's way like deep, kind of like right in the middle of your brain,
more or less. More behind your eyes. And so then it's going to get stretched. And what they're saying is that either it can be direct trauma from the forces of the bony tissue on the pituitary gland, or it may be changes in blood flow, because there's a huge vascular system that goes into the pituitary gland, and that vascular system is really how a lot of these hormones are transported from the brain, or releasing hormones are transmitted from the brain down to the pituitary, telling the pituitary what to secrete. And then these hormones are then secreted into circulation, so they can travel down to like your testicles, as an example. So there can be a vascular component. Sometimes it's just complete lack of blood flow and complete lack of oxygen that causes the pituitary to be damaged. Other changes could be neuroinflammatory. So we talked about the inflammation earlier in this broadcast, the neuroinflammatory cascade that's set off between the peripheral immune system and the central nervous system. So potentially by stretching your pituitary and hitting it within what's termed as the sella turcica, then that can result in inflammation. The immune system traffics to that area and starts trying to clean up the inflammation. It can get overreactive to the pituitary gland itself. The last one being autoimmunity. So where there's so much inflammation, the immune system actually can turn on the pituitary gland and start attacking the pituitary gland like it's a foreign invader, like it's a bacteria or a virus.
Right.
And so this autoimmune piece is very interesting because what we're seeing is that across the board, we have an inflamed nation. We have, you can pick a condition, we can probably tell you there's inflammation associated with it. We were just at a seminar this weekend.
No knee juice. That's the answer.
Exactly. Nonetheless, there's a lot of inflammation. What we're seeing is that when there's just this amount of inflammation that crosses a threshold, lots of times that will start attracting the immune system to start killing certain tissues. So
yeah, when you get those, and you talk about getting the blood vessels damaged, and that's where that blood-brain barrier is. So if you're already compromised when you get the damage, now let's say you have a bad gut, and you can look up some of our stuff on the gut-brain connection. We've done one of those, right?
The gut-brain connection, yes.
Yeah, you can look on that. We've done a couple hundred of these, I think. 100.
I think we have over 250 videos. Not all of those are on powerhealthtalk.com. Some of those are just selected to YouTube.
But if you have a bad gut or you have something already going on down here, and now you get a brain issue going on, you've gotten a concussion, and it happens to damage those vessels going to the pituitary gland. Now all the inflammation and immune factors and the toxins and all that type of stuff gets in there too.
Right.
So again, this is why we melded the two disciplines that we have. Dr. Gates is a board certified functional brain guy, neurologist, brain and entire nervous system, and then functional medicine works with all the other aspects of it. But by nature, they cross. The brain controls a lot of the things that make your gut and your adrenals and all these other organs not work, and then those organs kind of eventually can send bad chemistry to the brain, and then that makes it more difficult to do the brain exercises out there or whatever type of rehab or counseling or you might be doing to get better from the side effects from your concussion or any type of I want to say emotional or any type of counseling or any type of things. Bad chemistry in your brain, it's not going to work as well. You're not going to be able to respond as well to a variety of different treatments.
Right. And so I want to clarify one thing. As a board certified chiropractic neurologist, it's called functional neurology for those of you out there who are wondering, because it's called functional neurology because we look at the function of your brain.
Right.
Because so many of you have had CT scans, you've had MRIs, they were normal, but your brain is not functioning correctly. So what we do is through our exam, we figure out which areas of your brain are not functioning correctly, and we go ahead and we try and rehabilitate, get those areas functioning better through certain exercises, certain stimulations. But what we found is that this model works a lot better when you combine the functional medicine side, which is everything Dr. Rutherford said, between your biochemistry and your gastrointestinal tract and all that.
So let's go through the specific effects that somebody might feel if they've had a concussion and their pituitary has been affected.
Okay, so this is the exciting part. Were you gonna say something else?
No, go right ahead.
So
like adrenals, sex hormones, growth hormones, thyroid, whatever. Let's go through that.
So here's some of the data. So the data has varied between how prevalent of a problem this is. Underestimates or the low estimates are that 20% of those who have had traumatic brain injury or concussion have pituitary dysfunction. Clinically, pituitary dysfunction, where you run lab values and your hormones are low in one shape or form. However, the new statistics are as high as 55%. So that's 1 out of 2 of those who have suffered a traumatic brain injury or concussion have, and it's not just acute. These changes can be up to 5 years after a concussion, where we're seeing clinical changes in lab values on these hormones. And also the reason why the number went so high was because they combined not only just lab values, but also physician diagnoses. So you can have a doctor there sitting there and say, okay, well, your testosterone maybe is 356 and borderline low is 350, but you have all the symptoms of low testosterone. So you have a problem with your testosterone. So you are diagnosed as having this secondary testosterone deficiency because of a brain issue. So this is just very, very significant to the post-concussion, post-traumatic brain injury sufferer, because so many of you out there have these persistent symptoms of depression, fatigue, poor concentration, emotional lability, where you get angry really easily, then you're crying one minute, and then You know, you're fine the next minute. You have spatial orientation problems where perhaps you're getting lost going places. You just can't remember things. You're walking into rooms because your working memory is abnormal. And these hormones can have great impact. Are these hormones the end all be all? No. Do we assess all these hormones on patients coming into this clinic with traumatic brain injury? No, because lots of times when we have found, when we clean up all those other neuroinflammatory problems and problems with the blood-brain barrier and issues with the gastrointestinal tract, we don't need to go back in and look at all these hormones in depth. But sometimes we do. And so then we further evaluate growth hormone. We look further into cortisol problems and thyroid issues and testosterone deficiencies. But the point being is that this is a really common problem. And for those of you who are still having persistent symptoms, it's probably a good idea to talk to your neurologist or your doctor about maybe having your hormones checked, maybe seeing an endocrinologist to have this further evaluated. Now, relative to the statistics, they can vary in terms of which hormone is most commonly affected. So some studies say adrenal hormones are most commonly affected. Most of the studies I found really found a preponderance of patients having growth hormone abnormalities. Human growth hormone helps us to heal from injuries. Human growth hormone is very high when we're in childhood, and that's why kids heal really fast. That's why kids can play sports one day to an extreme and they can play the next, because their body's making tons of growth hormone to help them grow and develop. What we're also finding is that when growth hormone is deficient, they did a great study where they compared traumatic brain injury patients with normal growth hormone versus traumatic brain injury patients with abnormal growth hormone levels. And there was a stark difference in that those with low growth hormone, many areas of their brain involved with all those symptoms I just listed, primarily their frontal lobes and their memory areas, were not working correctly, had less blood flow associated with the decrease in human growth hormone. And it makes sense because you have inflammation in your brain. You have a trauma in your brain. So if you don't have enough growth hormone, because then the pituitary shut off, how are you going to help to heal as well as you could have potentially with normal growth hormone when it's not there? So that's the point. And so in essence, testosterone and adrenal hormones are about the same in terms of their prevalence. I say testosterone because a lot of the studies focus on males coming out of boxing or football. Estrogen certainly can be deficient in the female. And then thyroid hormone actually was the least prevalent problem, but it can be a problem where thyroid hormone can be shut down because the brain's not sending enough signals to the thyroid gland. So that's kind of the skinny on all of that data.
Yeah, so for those of you who maybe have started to develop some of these symptoms, maybe you're having, maybe you're a woman and you're getting testosterone dominant type of symptoms, or you're a man and you're getting estrogen dominant, you're getting more emotional, you're putting on weight, you're getting man boobs, if you will. You start getting thyroid problems and you're driving your endocrinologist totally crazy because they don't know what to do with you. It's up, it's down, it's sideways, it's Hashimoto's maybe, but maybe it's this. You're getting adrenals. Well, I don't feel stressed. I don't feel nervous, but I've got all these adrenal symptoms. I can't go to sleep. I wake up in the middle of the night, can't go back to sleep. This really needs to be part of the diagnostic workup. And is this common? Yes. I mean, we have by latest estimates from a variety of different credible sources, we have 130 to 160 million chronic pain patients in this country. And the understanding of why that occurs has to grow. It really needs to become more comprehensive so that histories take into account everything that it could be. And on the intake history for these abnormalities with this type, with the fact that most people have whacked their head at some point in time, with the fact that it may be 20 to 55% of those people may start developing these abnormalities. It needs to be really understood as to where it's coming from. Now, it may be that it's coming from the brain, and as we're calming down the gut, as we're calming down other systems, as we're working with the thyroid, that calms down immune inflammation, it gets better. But still, diagnostically, it's valuable for you to know where it's coming from, not just now, but for the future, like Alzheimer's types futures and things of that nature. Mm-hmm. So this is a really big deal, and it's something that is almost never evaluated or taken into consideration when people, especially in alternative
Right.
groups, not because alternative doctors are bad, most people consider us alternatives, but because most practices don't have the advantage of looking at it from a neurological and endocrinological or neurological or general systems perspective, because that's not how our system is set up. Our system is set up as one guy's over here is looking at your thyroid, this guy's over here looking at this, your alternative guy is looking at your adrenals, who knows who's looking at your thyroid. And so it's really kind of a challenge to get all this together diagnostically for the patient. So if you're looking at this, frankly, you're very fortunate. You may be able to look back in your history and see, oh, I had that, and that's when that change occurred, and maybe this is what I need to do. And I would say, what do they need to do? But I wrote this down, and I can't read my own handwriting, and it doesn't make sense to me. So you're going to have to tell me how does the lack of these hormones affect a traumatic brain injury sufferer?
Well, basically, it can perpetuate your symptoms. Oh, and really, they were looking at, okay, well, if these hormones are deficient, certain neuroprotective hormones, and so what they saw is that generally, even though certain estimates say that female soccer players can be more likely to have post-concussion syndrome, what we find is that estrogen and progesterone tend to be neuroprotective far more than testosterone is, and so they started doing studies where they're giving guys who had traumatic brain injuries estrogen and progesterone, started doing it with mice, and really they found no benefit from that. So that's one point I wanted to comment on. But we do really want to hammer that if you've had a traumatic brain injury, you need to get these hormones checked. You need to see your doctor. You need to have this conversation with your doctor, or find somebody who can have that conversation with you so you can have this all evaluated appropriately. And also pay attention, go back and watch our other broadcasts, because there's a lot more going on than just the hormones. This is just one little piece. Probably in the next week or two, we're going to be talking about the gut as it pertains to traumatic brain injury. Okay. So I'll kind of do a little lead in there for those of you who want to watch it. What we're finding is that significant percentage of traumatic brain injury sufferers will have this paroxysmal sympathetic hyperactivity. What that means for you is that the sympathetic nervous system is your fight-flight response. And they see 200 to 300% increases in stress hormones, namely like adrenaline, surges after a brain injury. And this is thought to be one of the leading factors behind why the gut breaks down. And when the gut breaks down, when there's all these stress hormones, and that can create more inflammation in your system, further perpetuating the whole neurological injury that you have going on in your brain. So that's one piece. Another piece that they're really looking at right now is that they've questioned relative to those who have chronic traumatic encephalopathy, which is a thing unto itself. We did a broadcast on it, go and watch it. But that's what they're talking about with these NFL football players. Certain individuals develop like a severe Alzheimer's-like illness, and it can have a number of different features associated with like self-mutilation and things of that nature. And they're wondering if steroid abuse had a factor relative to chronic traumatic encephalopathy, and they are seeing an association there, because when individuals take too much testosterone and they have a brain injury, and this is a big problem now in the, let's say, in the fighting world, so they're really trying to crack down on it, because a lot of fighters are taking steroids to get a competitive advantage. But when you take these steroids and then you have a brain injury, it actually further perpetuates brain damage, axonal injury, things of that nature, than what was previously thought. So that's another piece to consider.
And to even complicate that, those traumas probably set off immune inflammation. You probably set off immune problems, or if you already had an autoimmunity, or if you already had gut problems, or if you already had something like that. Now you get the brain trauma, and now the rest of your system is off to the races. So it can get a little complex, but the complexities are beginning to be more and more understood and more well known, and we're able to use the data. We've had really good success, for example, with concussion patients, like really good success. But because
in the properly selected
patient, yes, absolutely. Yeah. But because we've had the advantage of being on top of this, and we have the advantage of being in pushing two disciplines together that give us the tools to work with this. So it's so this is a pretty cool topic to me. I don't know how many people are actually going to watch it. I don't know how many of you are actually going to tune in. Concussion is becoming much bigger. We didn't put pituitary gland in the title because most people might go, concussion, pituitary gland. Well, that's not me. Well, if you have concussion, almost any other symptom, and it's 20 to 55% of the population, and it can come on up to 5 years later, there's probably at least a 50% chance that it is you. And it's something that if you're 5 years out from a concussion, you may or may not have made the connection. You're still having those symptoms. You're going to doctor after doctor, medical doctor, alternative doctor, nothing's going away. Look to the brain. Look to the brain. It is the biggest saboteur of everything so many alternative practitioners are doing. It's becoming understood. They're starting to come out with these little machines, put a little machine on your brain and it's going to synchronize your brain or it's going to calm it down. They have some value, but they're not going to fix this. And that would be putting it mildly. And so, you know, this is for the practitioner who doesn't have the advantage of having a background in brain or neurology or anything like that and understand the specificities of how to address that. So anyway, that's the topic. I hope whoever watches this thinks it's as cool a topic as we think it is, because it is hugely important in the diagnostics of chronic pain patients of all types across the board. If that person has had a concussion, you can almost always go back and observe a change in function from before or shortly after that. It's huge, and it's something that you need to understand.
Yep, exactly. Well, thank you for watching. If you want the articles we attach, go to powerhealthtalk.com, search the title of today's broadcast, or you can just search concussion. It will come up, and then go to the bottom of the page. All the articles are there. If you want more information, as Dr. Rutherford said, peruse our website, powerhealthtalk.com, and we will see you next week.